A special good morning to you and welcome to The Point for today, the 9th day of the month of December. I'm Joseph Cadore, you call me JC, and indeed it is a pleasure being here with you. I've been here with you since 6 this morning. As intimated, today it's a special production in collaboration with the St. George's University School of Medicine, and certainly we're going to get into that conversation right now. That was just about a year ago that the St. George's University developed a state-of-the-art diagnostic molecular facility at the campus with the intention of providing the campus and Grenadian community with timely and appropriate testing services in Grenada and the region. Well, previously, most diagnostic testing, as you may be aware, had to be sent outside of Grenada for analysis, often creating long lead times for receiving the results. The lab is housed in the Windward Islands Research and Education Foundation, WINDREF building, and was constructed to meet World Health Organization. So as we say in local parlance, it's not a PAF lab. They are good to go, fully certified. This morning, just to continue to let you know that Dr. Callum McPherson, Director of the Research at the SGU, envisioned that the lab will further enhance international and regional partnership with groups such as the Pan American Health Organization, Caribbean Health Agency, that's CARPHA, and universities worldwide, and has recommended that this expert panel, who were a key part of the COVID-19 response in collaboration with the Ministry of Health, to share data-driven facts about COVID-19 pandemic here in Grenada. Ladies and gentlemen, boys and girls, I introduce to you my panel this morning from the St. George's University School of Medicine, Vanessa Matthew Belmer, and she's from Granborough, a local girl who attended the St. Joseph's Convent in St. Andrew and obtained a Bachelor of Science in Life Science and a Master of Science in Bacteriology. We say welcome to her. We say good morning also to Dr. Jane Noel, no stranger to any one of us. Certainly, she is a University of Cambridge medical student graduate, and she completed a medical clerkship at the Grenada General Hospital in 1989 and moved her family to Grenada. And she's worked extensively with a lot of number of different organizations, swimming, athletic, anything. Once it comes to sports, Dr. Noel, she is right on with it. There's Tanya Khan. Tanya Khan earned her master's in public health at the St. George's University, and she has been involved in the COVID-19 vaccination since the arrival of the vaccine on the island. Then there's Nikita Kucho, a graduate from the St. George's University with a master's in public health. And last but not least, Nandi Noel, who attended the St. Joseph's Convent, St. George in Tam CC, and she has a bachelor's degree in chemistry and is currently working towards a master's of science in research and biotech. Ladies, good morning. Welcome to The Point. It's good to have you here.
Good morning. Morning.
Everybody came across. I could see that. I could hear it now, Dr. Jane. Most of them are actually convent ladies. You hear that, honey? They said it in unison. Good morning. I can understand that. That's the St. Joseph's Convent. Ladies, I know we've been waiting. I know you're excited to start sharing, and certainly Grenada awaits the findings of your research that we are going to discover and hear from you in the next hour. Again, ladies, notwithstanding where you are, we say good morning to you. Those of you that is joining us via radio, television, if you follow us via the World Wide Web at www.gbn.gd or via our Facebook page or YouTube channel, welcome to The Point yet again. Where do we start the conversation? Ladies?
Well, thank you. Good. Thank you very much for that introduction. We're excited to be here. There are 5 of us here today, presenting as members of WINDREF, and we're supported by St. George's University. And we've been invited here today to speak to our community about COVID-19, our work, the vaccine program, COVID testing, screening and surveillance, and to address your concerns, the general public, on these topics. So firstly, let's start with a little background on vaccination so that you can understand things a little easier. The first vaccination, created a little over 225 years ago, was by Edward Jenner. And this was against smallpox, which was a disease that killed almost 300 million people worldwide. You can see what an awful disease it was here in the pictures. So smallpox is one of only 2 diseases that's been eradicated from the world, and that was by rigorous vaccination. You can see here all the diseases that we vaccinate against at present. Our generation is so fortunate that we no longer have to worry about these illnesses that we see on the slide, killing our loved ones. And this is something our grandparents did not have the luxury of. And this is basically down to vaccination. Now, we allow our children to be vaccinated to go to school, and we don't worry about it. We know it protects our children. And now we're being asked to vaccinate as adults against COVID-19 because we know it protects us. It's important to remember that anyone who travels to an endemic area has to vaccinate for diseases found in that area, such as yellow fever. When we travel to Southeast Asia or other countries, we have to vaccinate. And prior to COVID-19, Grenada had an incredible attitude towards vaccination, and it was shown by a 96 to 98% vaccination rate in our school children over the last 30 years. Now, this is a picture here of the chief community health nurse receiving a trophy from Windriff for being the parish with the highest vaccinate rate for school children. So Grenadians believe or did believe in vaccinations.
So let's take a closer look at what the COVID vaccine really is. We take vaccines in order to teach our immune systems to recognize and defend against harmful germs such as bacteria and viruses. All of the illnesses mentioned by Dr. Noel have different types of vaccines associated with them. So every one of you listening today has had at least 3, if not 4, of these different types of vaccines as a child. And specifically, the COVID-19 vaccines that we have in Grenada are either viral vectors or mRNA-based. So most people don't seem to realize that the journey to developing a vaccine for COVID really started about 20 years ago. So it's important to understand that, including the common cold. So COVID-19 is not the first coronavirus that we have encountered, but it is the one that has figured out how to spread rapidly and silently across the globe. So in 2002, there was SARS-CoV-1 pandemic, and this virus had the same spike protein on its surface that we see in COVID-19, and therefore it invaded cells in the exact same way. And the next coronavirus pandemic was in 2012 with the deadly MERS-CoV, which killed almost 40% of those infected. In both of these cases, many academic institutions came together to develop a vaccine against these coronaviruses. So in 2019, when SARS-CoV-2 or COVID-19 was discovered, scientists had already been studying and learning about the virus and the vaccine for about 17 years. When COVID-19 began spreading around the world, we already had the knowledge and the technological advancements to develop the vaccine. The different trial phases were done simultaneously, which allowed for the record-breaking rapid production of the vaccine. A range of vaccines were made, and that included Oxford AstraZeneca, Pfizer-BioNTech, and the Janssen Johnson & Johnson vaccines. So all of these vaccines were screened for safety by the WHO and the CDC before release. I also want to say that the definition of vaccination, according to the CDC, is the act of introducing a vaccine into the body to produce protection from a specific disease. So there are really no vaccines that prevent disease 100%. The COVID vaccine massively reduces the chance of infection, therefore producing protection against acute illness, long COVID, and death.
So now we're going to look at some of the key events regarding COVID-19 vaccination in Grenada. And this is using our data from Grenada that we have collected during the vaccination program. So first of all, vaccinations with AstraZeneca began being administered in Grenada on February the 12th. And this was with frontline workers first, and it was quickly followed by the general public. Secondly, initial vaccination numbers were encouraging, but they quickly dropped with the AstraZeneca blood clot scare. Now, even though the World Health Organization found the vaccine to be safe, the local uptake of the vaccine slowed, and it's never really recovered.
The increase in uptake seen at 3 coincided with St. George's University becoming the first entity to mandate vaccinations. And on June 1st, SGU also began denying entry to the campus for unvaccinated individuals. The 2 following spikes, seen at 4 and 5, coincided with 2 different batches of AstraZeneca expiring. The decrease in uptake seen here at 6 represents the period of time when the Pfizer vaccine was promised to Grenada and people decided to wait for it. Next, there was an increase in vaccination uptake due to the arrival of the Pfizer vaccine on the island, along with some panic within the public with concerns about community spread in Grenada and also the subsequent deaths. Once the Pfizer vaccine arrived, the vaccination rate was pretty constant at about 500 to 600 doses per day. And from mid-October, as the cases have dropped and the death rate has stabilized, the vaccination uptake has dropped to under 200 doses a day and has continued to stay this low.
Now, there have been over 265 million cases of COVID-19 and over 5.25 million deaths worldwide. COVID cases and deaths have shown a distinct pattern of peaks and dips that coincide, and Grenada should expect this same pattern. We cannot become complacent and think that we will avoid this. Now, the Oxford AstraZeneca vaccine has been used in actually 34 more countries worldwide than Pfizer. And the maps here show the overall confidence worldwide in both these vaccines. They are both equally effective and both equally safe. Sadly, Grenada is really lagging behind our fellow Caribbean islands in vaccination uptake. As you can see from this chart, Grenada has only 34,943 fully vaccinated people, which is very low. We are right down there at the bottom, actually in the bottom 5 with our other Caribbean islands. And seriously, come on, guys, when was Grenada ever at the bottom of anything? And honestly, guys, we can do a lot better than this. Now, no one can argue that vaccination has not prevented death and serious illness from COVID-19. The graph here, using current statistics out of the United Kingdom, shows unvaccinated people in blue have been significantly higher death rate compared to the fully vaccinated individuals shown in green, which runs along the bottom. Vaccine reduces chances of death from COVID. It's a fact. We are now learning that COVID not only has a short-term deadly phase, but there are severe long-term effects. Post-COVID-19 syndrome, which is known as long COVID, is now a reality. Even patients who were asymptomatic are developing a number of life-debilitating symptoms months after the infection. These can include shortness of breath, chest pain, brain fog, joint pain, stroke, worryingly the onset of new dementia that wasn't seen before, and long-term flu-like symptoms. And these are being seen in Grenada. Worryingly, multi-system inflammatory syndrome is now being seen not only in adults, but also in some children, either during the COVID infection or directly after. And this really highlights the point that not only adults, but also our children 12 and over should be vaccinated, and we really need to push this.
So Dr. Noel and I have been in the thick of the vaccination program since the arrival of the AstraZeneca vaccine back in February. For the past few months, we have been based at the new Guelph Polyclinic, and it is important to note that the Guelph area was actually the epicenter of our recent wave of cases. We have talked to thousands of people at the vaccination centers, pop-up clinics, and throughout the community. Of all your concerns, these are the top 10 reasons that people have been hesitant towards the vaccine. First of all, we realize that there is a lot of misinformation out there. Every day, you can go onto Facebook, WhatsApp, Twitter, and TikTok and find hundreds of people and influencers offering their biased opinions and taking facts out of context. You cannot take the opinions of film stars, pop artists, or just anybody from the internet to dictate what you will do with your life. The unbiased sources that we recommend are the CDC and the WHO. If you have concerns about the vaccine, please come out to the vaccination clinics, and we would be happy to answer any of your questions.
to address concern number 2, and that's the concern regarding the blood clot scare that we had with AstraZeneca. Now, if you look at this infographic picture, the risk of blood clots from AstraZeneca is actually 300 times less than if you were taking the oral contraceptive pill. It's 440 times less than if you smoke cigarettes. And there's a lot of you out there who are smoking cigarettes. And it is 41,250 times lower than if you actually catch COVID. So essentially, if you catch COVID, you are at a significant higher risk of having a blood clot than if you took the AstraZeneca vaccine, which will protect you from the COVID, right? It has to be kept in perspective. Now, thirdly, many people in Grenada suffer from sugar, asthma, obesity, pressure, sickle cell, and various cancers. All of these are chronic illnesses, and they make you much more at risk from having serious problems if you catch COVID. In fact, if you have diabetes, you have a 100 to 250% higher risk of death if you catch COVID than someone without diabetes. So the vaccines don't make these illnesses worse. They, in fact, protect you. So you are a top priority to get vaccinated.
The fourth reason is that many of you are not fully understanding the benefits of vaccination. You can still catch COVID after being vaccinated, but the vaccine prevents you from becoming severely ill, hospitalized, ending up in intensive care, having to use a ventilator, or the very worst, dying from COVID-19. If you look at the graph on the screen, you can see that of the 200 people who have died in Grenada from COVID-19, only 6 were fully vaccinated, and they all had chronic diseases. 190 or 95% of the COVID deaths here were unvaccinated people. The numbers don't lie, and this is not data from another country. This is our data from our small island. The data speaks volumes about what is happening, and we all need to start paying attention. The fear of needles is the next common reason for hesitancy. I want to reassure you that your nurses and doctors are experts in administering vaccination. I would know, I've seen them every day out there, and they will ensure that you feel very, very comfortable. The sixth reason for hesitancy is that many people have a waiting to see mentality. In the time that you are waiting, it really could be too late. And Dr. Noel will now share a story with you about one such example.
So this is about our dear swim coach, Natalie Regis from Fontenoy, who traveled with me to the Tokyo Olympics. So she herself was vaccinated, as was the rest of the team. However, her family did not vaccinate, and her brother Ali, who was an active, physically fit young man who ate well and exercised regularly, caught COVID. He became sick very quickly and shockingly died from COVID despite everyone's best efforts to resuscitate him. Now, it's been devastating for Natalie and her family. And since then, Natalie has been volunteering at the Guelph Polyclinic with us to try and help get people vaccinated. She's gone through this tragedy and she doesn't want to experience it again, so she has joined us to advocate of vaccination. Now, people who die from COVID-19, they die alone. There's no friends with them, no relatives to sit next to them or comfort them as they approach death and finally pass. And this is just so utterly sad. As healthcare workers, we've been there and we've seen the devastation of death, and we want to help people avoid the unbelievable heartache of knowing that this could have been avoided.
The seventh reason is peer pressure, which we have observed on many occasions at the clinic or when we have gone into the community to speak to you. Your friend or relative may have an opinion, but at the end of the day, you should make your own decision. You will be surprised that some of those with the most opinionated views have quietly vaccinated to protect themselves.
Now, number 8 on the list. Some of you guys, in fact, some of you women out there are worried that you could be made sterile, that you won't be able to make kids. And there's just no truth in this rumor. There are plenty of babies being born to vaccinated parents, both here and worldwide. So on that note, let's look at reason number 9, and this is really important. This is pregnant ladies. Now, the World Health Organization and the Center for Disease Control, and in fact, all major obstetric institutions worldwide have advised very strongly that pregnant women at any stage of pregnancy, or if you plan to get pregnant, should take a vaccine. Pregnant women are at a higher risk of severe COVID because their body is already under pressure from carrying the baby. Pregnant women are more likely to end up in hospital, in intensive care, or on a ventilator if they catch COVID. They are at risk of having a premature delivery and needing an emergency cesarean section, which can put their baby and themselves at risk. They can pass COVID to their newborn baby, which can endanger the infant and, in fact, cause death in the infant. Early on in pregnancy, there is an increase of miscarriage if you contract COVID while pregnant. So the vaccine has had no adverse reports in pregnancy, no reports of causing miscarriage, so it is safe. Pregnant women, you all need to get vaccinated as soon as possible to protect yourself and protect your unborn child. And finally, number 10 is breastfeeding mothers, and you definitely need to get vaccinated. There's no risk of the vaccine affecting your baby. It doesn't cause COVID in your baby. It doesn't affect them through the breast milk. You can carry on breastfeeding. So please, please come out and take the vaccine to protect yourself and your small child.
I want to leave you with a final message. So far, we have lost 200 of our Grenadian people to this deadly virus, lost to a disease that can be protected against. As cases soar in the Caribbean and Europe, especially with the emergence of the new Omicron variant, it is clear that this has now become a pandemic of the unvaccinated. Grenada has been very fortunate to have a choice between 3 vaccines, so we must take advantage of this opportunity and vaccinate. So now that we have discussed the vaccines, I will hand you over to Vanessa to take up the story of testing.
Thank you, Tanya. As the virus was sweeping across the globe, the St. George's University Windward Island Research and Education Foundation team decided there was a need to prepare. On the 30th of March 2020, the SGU Windrift COVID-19 diagnostic team started testing for SARS-CoV-2, the virus that causes COVID-19 disease. We were the first island to test outside of Trinidad, and with the fastest result turnaround time when SARS-CoV-2 arrived in Grenada on March 16, 2020. Access to testing leads to the quick identification and isolation of persons infected, thus helping in the control of the spread of SARS-CoV-2. At the beginning of testing, all positive samples were sent down to the Caribbean Public Health Agency, CARFA reference laboratory for confirmation. To date, we have tested 18,359 samples by real-time reverse transcriptase polymerase chain reaction, QRT-PCR. This test is the gold standard that is approved by the World Health Organization. It is a highly specialized skills in molecular biology, and I am a proud Grenadian from the big parish of St. Andrews. I have been working in polymerase chain reaction for the past 10 years, and our lab is equipped to test for SARS-CoV-2. Now let me explain to you the process for testing for SARS-CoV-2. First, a nurse or a doctor takes the swab and collects the sample from the back of the nose, otherwise known as the nasopharynx. Then the sample is put inside the tube with media for the virus, which allow us to transport and store the samples. The samples then comes to us, the diagnostic team, and we perform QRT-PCR in the SGU Windrift laboratory. So now let me take you on a tour in the SGU Windrift state-of-the-art molecular biology laboratory. The laboratory is World Health Organization approved testing site for SARS-CoV-2 testing. In the past 2 years, we have achieved 100% concordance by the World Health Organization in proficiency testing for SARS-CoV-2, meaning our tests are highly accurate. In the lab, we suit up or put on our personal protective equipment, PPE, and this comprises of the N95 mask, goggles, gloves, whole suits, shoe covers, and head covers because we want to protect ourselves from the very contagious SARS-CoV-2. We then move into the extraction room where we remove the ribonucleic acid, RNA, from our nasopharyngeal swab. Next, we prepare the master mix for the reaction, add it to the PCR plate. After, add the RNA and then load the PCR plate into the real-time PCR machine. All these steps are done in a careful manner in 3 separate rooms to avoid contamination. qRT-PCR is a diagnostic tool used for the detection of disease-causing agents. It can find a small number of viruses present in the sample. In that test, we use 2 target genes, 1 the E gene and 2 the RDRP gene. If the E gene is positive, we use a second gene, RDRP, to confirm, since it's very specific and only SARS-CoV-2 contains that gene. For persons traveling, this is required test to enter certain countries around the world. Results are given within 6 to 8 hours, meaning that one can get the results the same day. We can read the results based on the CT value. The CT value is the number of cycles needed to amplify viral RNA so it can reach a detectable levels. Once you have that reading, we can tell if you're positive or negative. For the positive, the CT value of 29 and under means the sample contains a lot of virus. CT value 30 to 37 means moderate virus, and CT value 38 to 40 indicates very low virus. No CT value means there is no virus found. The rapid antigen test is another test that is used to screen for SARS-CoV-2. It is very quick, cheap, and easy to use. For persons traveling to the United States of America, rapid antigen test is accepted. Now, I will talk to you on the variants of SARS-CoV-2. An important factor in the evolution of coronavirus is the high mutation rate to substitution in the genomes. The process is known as a mutation. A virus with 1 or 2 mutations is known as a variant. Mutations can lead to various degrees of outcome. All COVID-19 tests can detect SARS-CoV-2, but will not tell you which variant is present. Now, SG Windriff Laboratory has purchased 2 sequencers which are capable of diagnosing the variants of SARS-CoV-2. The most important variant is the variant of concern, which I will discuss next. Variants of concern means there is an evidence of increasing transmissibility. More severe disease, for example, increased hospitalization or deaths. Significant reduction in the neutralization by antibodies generated during previous infection or vaccination, reduced effectiveness of treatment or vaccine, or diagnostic detection failure. There are 5 variants of concern, which are Alpha, Beta, Gamma, Delta, and Omicron. The newest addition of variant of concern is the Omicron, detected in South Africa and from travelers in Botswana and Hong Kong. Cases of Omicron are confirmed in almost 50 countries, including Austria, Australia, Canada, Spain, France, Brazil, Japan, United States, and India. Omicron has 15 mutations in the spike protein, which is a lot higher than what we have seen in other variants such as Beta and Delta. Delta is still the most dominant variant globally. It is presented with a high viral load in infected individuals. It persists longer than other variants with 5 or more infectious days. People with the past infection have higher risks of getting infected, which is why vaccination post-infection is so important. Currently, the new variant Omicron has been officially reported in South Africa and Botswana, and as I mentioned, has now been identified in more than 50 countries. This has given rise to immediate changes in travel protocols all around the world. The immediate economic impact of this variant has been highlighted by the recent $100 billion loss on the stock market. Grenada, we cannot let our guard down. We must continue to be vigilant, follow protocols, and vaccinate. So now I will hand you over to my colleague, Nikita Kujo, for the screening and surveillance story.
Thank you, Vanessa. Now that the viewers and listeners have gained insight into vaccination and the importance of it, and the testing capabilities and the certifications at the Windruff Lab, we'll now quickly move on into the results from the airport testing, the screening programs, and the surveillance within the SGU community. From the 17th of July to the 30th of August, SGU partnered with Windruff for the testing of incoming flights to Grenada. This partnership was facilitated due to the large influx of SGU students for that fall 2021 semester. However, during this period at the airport, it was not only limited to SGU affiliates, but also to returning nationals and visitors. At that time, all SGU affiliates must be fully vaccinated and must provide a negative PCR test 72 hours prior to flight. Now, we were able to put together a Windruff response team, which includes nurses, to allow that seamless sample collection at the airport. After sample collection, SGU affiliates were transported to a government-approved quarantine site via an approved airport taxi. We've tested over 3,500 samples. Of those, we have identified only 12 SGU affiliates and 4 returning nationals and visitors from the Windruff testing. These individuals remain in quarantine and were cleared based on a negative PCR test result. Those that tested positive, of course, were isolated, retested, and cleared by the Chief Medical Officer based on a negative PCR test. Apart from testing of the airport samples at the Windruff Laboratory, testing was also being conducted at the Ministry of Health Grenada Lab. Now, during that period of time, both testing facilities identified 32 imported cases. Now, of the 32 imported cases identified, during that period of time, 62% were returning nationals and visitors, and 38% were SGU affiliates. I would like to reiterate here that 12 of the 32 imported cases were SGU affiliated and remained in isolation until they had that negative PCR test and was cleared by the Chief Medical Officer. SGU, in partnership with Windruff, have also been conducting ongoing surveillance within the SGU community since August 2020, and we have even ramped up our surveillance and testing to daily. Testing for individuals within our SGU community is free of charge and is similar to any of the public health institutions, such as the health centers, where you can get tested for screening purposes at no cost. Results are provided the same day or within 24 hours, allowing us to quickly identify that positive case, isolate the individual, and then start that contact tracing process immediately. I'll now hand you over to Nandi, who will discuss the screening and the surveillance programs. Nandi?
Thank you so much, Nikita. So in light of the increase in number of cases associated with our first Delta wave, SGU mandated that all students, staff, and faculty be tested. This mandatory screening session was open to individuals who had access to campus, including our visitors, our fishers, our vendors and contractors, our significant others, and even our family members. This is especially so since our SGU community is very diverse and is represented in all parishes in Grenada. During our first screening session from August 26th through to September 5th, we have completed over 3,500 tests and identified 49 breakthrough infections. You may ask, what are breakthrough infections? Breakthrough infections are individuals that are fully vaccinated and have tested positive for COVID-19. It's important to note that no one in our SGU community has been hospitalized. We take this opportunity to recall and make comparison to Dr. Noel's earlier point that scientific literature and global data shows an immense gap between hospitalization and death between the unvaccinated and vaccinated individuals. Of all our testing sessions, no matter screening or surveillance, results were provided to individuals within a 24 to 48-hour period. Upon discovery of a positive case, immediate contact tracing was initiated to those individuals and they were promptly isolated. They were later medically cleared by our Chief Medical Officer upon a negative PCR test. Note that this screening session was not limited to just the SGU personnel, but was extended by the SGU Windruff Laboratory to our family members and the direct contacts of positive cases. There were 2 mandated screening sessions. The first started 1 day prior to the announcement by our Chief Medical Officer of Community Spread, which was on August 27, 2001. And the second was from October 8th through to October 15th, 2021, where we tested over 2,500 individuals. When we compared both screening sessions, there were no positive cases identified in the second screening session. And this was mirrored by what was taking place in Grenada, where there were fewer new cases by community spread. This decrease in cases is a testament to science and its aid in being more than helpful in reducing our numbers. Countless papers have shown that the simple things, including hand washing, isolation, quarantine, ongoing testing, because if you do not test, then technically speaking, the virus does not exist, physical distancing, mask wearing, and vaccination can drastically reduce the spread of SARS-CoV-2. In addition to the mandating screening programs, SGU surveillance sessions were conducted for all students, staff, and faculty, or anyone that would like to be tested within the SGU community. The non-mandatory surveillance session from September 7th through to October 6th, we tested over 2,500 samples and identified 62 positive samples. Similar to the first screening session, breakthrough infections were noted, and these persons in the same way were immediately isolated, and contact tracing was then subsequently conducted. None of these 62 positive individuals were hospitalized, and none of them had what is known as long COVID-19.
Now that we're aware of the results from the mandated screening sessions and the surveillance period, I would like to reiterate that surveillance within the SGU community is ongoing, with results being provided the same day. The next few slides look at where Grenada ranks in comparison to the rest of the Caribbean islands. Grenada was one of 6 islands to have been exposed to the Delta wave. This Delta outbreak, our first wave, was mirrored with that of other islands, including Trinidad and Tobago, Barbados, St. Vincent and the Grenadines, St. Lucia, and Dominica. This graph was standardized per capita, allowing us to compare the data collected from other islands despite differences in population size. Similar to other Caribbean islands or countries such as Dominica, Jamaica, and Barbados, just to name a few, Grenada in the second week in August observed an increase in the number of cases. Grenada, which is highlighted in pink, had the highest number of cases per capita in mid-September. Then we can observe that drastic decline in the number of cases, which may be due to decrease in transmissibility and our adherence with protocols recommended by WHO and PAHO, such as hand washing, sanitizing, physical distancing, wearing a face mask, getting vaccinated, and ongoing testing, which has allowed us to quickly identify a positive case and allow that contact tracing to be initiated immediately. This graph was also standardized to per capita, and here we're looking at COVID-19 related deaths in the Caribbean. As you can see, Grenada is ranked very highly in the Caribbean. Reason being is that this was our first wave. We had a very successful lockdown period prior, which prevented further spread of SARS-CoV-2 and limiting our exposure to the virus. In addition to that, in early August, our vaccination rate was 17.7%, pretty low. These factors of a successful lockdown period, resulting in lack of exposure and a low vaccination rate, has made us an extremely vulnerable population.
Following the previous graphs per capita calculation, we also collected data on the number of cases among the Caribbean islands, and we see that Grenada has the 9th lowest number of cases in the Caribbean. Despite our number of cases and our well-publicized national vaccination campaign, Grenada still has a low vaccination rate of 30% fully vaccinated population when calculated against a total population, or 37% when using the population who are eligible to be vaccinated. We have compared our statistics to neighboring countries whose figures are, for example, 59% fully vaccinated in Antigua and Barbuda, or 48% in Barbados.
Trinidad and Tobago, Barbados, European countries are now seeing an increase in the number of cases, letting us know that the virus is alive, it's real, and it's changing. We have done a great job thus far, and we need to continue to remain hypervigilant. We need to follow those protocols. So let's protect ourselves, and especially our elderly.
For many of us, this past year, give or take a few months, has been a struggle. But we must continue to follow the protocols that recommend meticulous hand washing methods, wearing face masks, physical distancing, and most importantly, going out and getting vaccinated. Remember that protection is a necessity that goes beyond that of ourselves, and we see the need to extend that protection into our businesses respectfully.
As a Grenadian and a mother who have worked long hours conducting PCR testing to keep our community safe, if you have symptoms or you have had contact with someone with symptoms, I urge you to please get tested. And if positive, complete your quarantine to keep our children safe.
To bring back all the things that we love about Grenada, our festivities, our chance to celebrate life with our family and friends, and especially during this joyous festive season and holidays, please be careful. Don't let your guard down. Please follow the protocols and vaccinate to protect our community.
And as doctors, we take a Hippocratic oath to protect our patients. We have a responsibility to protect you. So please vaccinate and help protect our country.
So we have and continue to enjoy an excellent partnership with the Ministry of Health Grenada and other collaborators. There have been many people who have contributed to this process, both in Grenada and abroad, and we would like to take this opportunity on behalf of Grenada to extend our heartfelt thanks to you. But more so, we would like to say thank you to our citizens, our residents, our visitors, our returning nationals for your ongoing support, and to everyone who has been involved in this COVID-19 response. So we say thank you. Thank you for your time, and thank you for hearing our story.
Indeed, we say thanks to Team SGU, and certainly we appreciate the time and efforts. Team, remain with us, because certainly time is fast spent. It is exactly 20. Not 20, actually, it's 19 minutes onto the hour. And again, we want to say thanks to the team for probably those of you that are just joining us. Tanya Khan, Dr. J. Noel, Nikita Kujo, Vanessa Matthew Belmer, and Nandi Noel. Now, for the purpose of the program, we will take a commercial break, but we are going to fast forward things because time it is far spent. And I know, Dr. Noel, you are passionate about this whole conversation. Now, team, from your presentation, it is evident that there's been a lot of science that has gone into the delivery today. But yet, as part of the presentation, you did say, at one point in time, Dr. Noel, going back to the early days, where we were used to vaccinating our children, and we had a 98% belief in it. For some reason, something happened. And we talk about the misinformation and the other factors. Which of those factors, though, stands out most, you found, did your research indicate, stood out most as to what's given rise to this hesitancy and the low vaccination rate here at home? Dr. Noel?
Yeah, I think we've just taken vaccine for granted. So for years, we get given vaccine by our parents, right, before we go to school, and we have boosters, and then we get vaccinated when we go to senior school and we leave school. My example is, I've traveled with many teams abroad, and we've taken vaccines for yellow fever and hepatitis and goodness knows what, and there's never been any confusion, or no one's ever said no, they don't want to be vaccinated. And I think we've just become very complacent about these things, and then all of a sudden we've got this virus that's basically scared the whole world to pieces, and everyone suddenly thought, oh my goodness, they've suddenly come up with this vaccine that has been made in like a couple of months, and they haven't tested it properly, and they don't know why we should take it, and people have naturally been scared of it. It just was thrown at people. But I think people don't realize how much research has been put into this vaccine. I think people just literally don't realize it. And I found when we've talked to them in the clinic and explained it, they've been like, okay, well, we're fine to vaccinate because now we understand. As Tanya said, 20 years in the making, this vaccine, it wasn't just suddenly come upon. That technology has developed since we had the first COVID outbreak. And then the second COVID outbreak with MERS. And that technology has been there, and now it was so groundbreaking. This virus just has wiped across the country in such a way that in our living generation, we've never seen anything like this. And so all the companies came together and worked together, maybe for the first time ever, and money was thrown at this project so that they could run first and second and third trials all at the same time. And instead of just concentrating on one drug, they had the money to concentrate on multiple vaccines so that we would then have enough to cover the whole world, which is why we have AstraZeneca, why we have Pfizer, why we have Johnson & Johnson. They're all safe vaccines. They all work. They all protect us. And I think people just haven't understood where these vaccines came from. And the fact that they're as safe as all the other vaccines, if you look at their safety protocol and you look at the number of millions of doses that have been given worldwide, there's virtually no allergic reaction. They're probably safer than half the vaccines we already use. And that's the message we need to get across to people. And the fact that it does protect us. The graphs, the evidence that has been collected by universities, by recognized institutions, is literally proving that it keeps people alive. And that's the message people need to get across, and they need to stop being worried about it. They need to just bite the bullet and get themselves vaccinated to protect themselves.
I like the way you say it. Bite the bullet and do what has to be done. And,
yeah.
But you keep getting this through social media and traditional media as well, different forms of the media. And there is the overarching thought that the scientists, the experts, are not being truthful. Somewhere in there, you hear about the theories, and people are thinking, you know what? I don't believe them. What would your response to that be? Anyone, Nikita, Vanessa, anybody, Dr. Noel, what would the response be?
I can take that question. So I think for a lot of people, there's always new information coming out. And I think what we need to understand is that the virus is changing, and also that it is only with time that we can do more research and find out more information about COVID. This is all kind of new to us in terms of how it's evolving. I mean, we can see the variants. You know, we just have Omicron recently, right? And I also think that the fact that scientists are adding on to or updating what was said before shows that we are really not trying to hide anything, and we are observing and reporting as the information comes to us. So I think I would love for the people to start trusting the science a little bit more and just, you know, see that they are doing their best to get the most accurate information out there.
Ladies, I think our vocabulary should be well expanded, and we can all become medical practitioners. But we have, and let me just use the occasion to educate the public. We hear the term asymptomatic, transmissibility, and in more recent times, variant. Explain those terms in a simple language that you possibly can, so that the general public, ladies, can get an appreciation of what is it exactly you're referring to when we hear these terms.
I mean, transmissibility is really how easy it spreads, right? So the COVID has a high transmissibility. It spreads really easily, all right? You don't need to be coughed or sneezed at very hard for this to jump into you. Hence why the mask wearing and the sanitization and those sort of public health measures have been effective and are so important because it is a highly transmissible virus. Vanessa, you could talk about variants, yeah.
Variants is a viruses that is always changing. So every day you have the virus mutating. As soon as it gets into everyone, it's changing. So with these changes, there is new variant that is coming out. So we need to get vaccinated, follow the mandate, and protect and everyone.
Let me. Sorry, go ahead. Go ahead, Tanya.
Yes, I just wanted to define the word asymptomatic. So that's when you have contracted COVID. However, you are not showing any symptoms, which, we see the fever, the cough, the trouble breathing. So you're not necessarily showing these symptoms, but you can transmit the virus to other people. And that's what makes COVID so different from anything we've ever seen. And that's why we say it's the silent killer. It kind of spreads without anybody knowing. You could be on a bus next to somebody and they seem fine. And the next day, you might be feeling sick, but that person wasn't. So that's asymptomatic.
Well, thank you, ladies. Now, on the issue of the variants, what are the factors, though, or the variables, lady, that would cause these new variants? Because I think sometimes that's for people, the general public, it's almost like you become wary. So you start off one, you hear about Delta, you hear about this. When you started accepting Delta, all of a sudden, you get a new variant that seems like a theme from some Transformer movie, and the people are like, really?
We all feel the same way.
The virus is always changing. Every day that it's just all the organisms, they are fighting for life to survive. So a virus will do the same thing. They will fight to change. They will fight to survive. And in that order, that's where we have new variant coming out all the time because it's getting a chance to replicate and make new virus.
Having said that, Vanessa, it's important and it has me thinking, do you think at the end of the day it would require, ladies, an extensive education program? Because that you said that we as human beings, that's what we do. We adapt. And you put us into an environment, and by nature, we find a way. But after a while, and you say that about the virus, and all of a sudden it creates an all new life. Dr. Duval, you think maybe what needs to be done is that there be an extensive education campaign that not just starts with the adults, but with the toddlers from the junior level that seeks to educate the next generation.
You're dead on right. I mean, education is key to anything like this, to any public health measure. The more the general public understands about this virus, the more they understand and trust the scientists, that what they're being told is correct, that everything that is being done is to protect our people. None of it is to make life difficult for them. None is there to just annoy them. It is literally to protect them, to keep them alive, because this virus kills. And you're right, this is something that from the smallest child upwards needs to be educated, so it becomes much more of a natural thing to be protective, to be careful, to have good sanitation and health measures. I think education is always key in these issues.
I just want to add really quickly, if I may, to add on to what Dr. Noel just stated, but I think it goes beyond education and it goes towards empowerment. About 10% of our young people in Grenada are vaccinated, including myself. I'm fully vaccinated. I'm boosted. But I think that we also have an obligation to speak to the unvaccinated, the 90% unvaccinated young people. I sit and I have conversations with my friends and my neighbors, and I tell them, hey, get vaccinated. It's about being protected. But that empowerment has to come from those of us who are really involved in the process. You hear stories all the time of, they're the naysayers, the anti-vaxxers who go out and they tell everyone, do not get vaccinated. But in hindsight, when we as a team step back and we have one-on-one conversations with us, they'd show us their vaccination cards, or they say, I'm only saying this because, but they are vaccinated. So it'll be great to have that higher level of empowerment where we feel more comfortable to have a conversation about getting vaccinated and just going out there and getting the hard facts, the truth from reputable sources, CDC, PAHO, WHO. The information is out there. I think it's just a matter of us to encourage other people to go find the reputable sources and read and just take it from there.
trusting the science, finding the reputable sources. We trust in your team. Now, we've been through the first wave. Only this week we've had, a couple of hours ago, announcement by the health minister that, listen, it's all out. The curfew's ended, and we slowly trying to get back to normal. But all of this comes on the heels of the fact that there's a new variant that is out there, the Omicron, that is, from all indications, seems to have a greater level of transmissibility. We've had our first wave, 200 deaths too much. How concerned should we be, ladies, as to what could potentially happen next?
We should be very concerned because we could be getting our second wave. We don't know. So we have to use the preventive measures by getting vaccinated and continue to follow the government protocols that is mandated.
I think we've got our holiday season, and you can just see when you're out on the street, people are they've got their decorations up. It's been a depressing year for everybody. It's been a very difficult year for everyone, and everyone just feels that they need a break and that they need to go out, they need to party, they need to celebrate, and I'm all for that. But I think everyone has to realize that if we look across Europe, if we look across Canada, the States, South Africa, they're all going back into crisis with rising cases rapidly, rising deaths rapidly from Omicron. And for us to be naive and think that it cannot reach Grenada, well, it would be naive. So although we want to enjoy ourselves, we have to enjoy ourselves, but it always has to be in the back of our mind that we have to be careful. So we have to social distance, we have to wear our masks, we have to sanitize. Because it hasn't gone away, and everything could change in the blink of an eye, and we really don't want that in Grenada.
We want to trust the science, and time is slowly crunching away. We started off in the early days of the pandemic, there was a high vaccine uptake, and then we were happy to say that we didn't just flatten the curve, we decimated it. And I was always happy to say that, folks, the curve is no more. But in the midst of this, I continue to be wary, ladies, as to Grenadians went into sort of different mode. First there was COVID. There's a vaccine conversation, and then Grenadians got into I'm not sure they tapped into the primitive mind, and there was a conversation with the use of local homemade remedies, the use of the ginger. We Grenadians, we know what we do. How much of a factor, and I've often wondered whether or not, ladies, the reduction in the numbers we've seen, is it that Grenadians are following the protocol to the T, or more getting vaccinated, or is it people are just naturally decide, you know what, I'm not going to get vaccinated, I'm not going to go get tested, I'm just going to drink my ginger, my garlic, and everything else? How much of a concern is that to you, if that culture remains?
Good question. So I think it's also, apart from adhering to the protocols, the lockdown also did help. Limiting movement during that weekend period, it did help, and allowing persons to vaccinate and get tested during that period of time did help.
Yeah, definitely.
Yeah.
I mean, I think I am all for local measures. The ginger and the turmeric, and I mean, I think they're brilliant. They're brilliant. It's and people should continue to take those things because it does help your immune system. But I think what people are misunderstanding is that to fight this virus was new, and nobody in the world had ever encountered it. So nobody in the world, when this pandemic started, had immunity to it. Whatever people think. Yes, we have immunity to the common cold. Yes, we have immunity to some of the influenza. Yes, we have immunity to some things like TB because our parents were exposed to it, and when we breastfed, we got antibodies to it, and we've had mild doses of things. So we have antibodies. So yes, there are a lot of young people out there who are fit and they are healthy and they go to the gym and they have a good immunities, but they do not have immunity to COVID because they've never had it. Right, and this is the misunderstanding that the Grenada people have, that being fit and healthy will keep them alive if they catch COVID. And the example of Ali Regis, fit, young, healthy, dead. And that's all I can say. It is a misunderstanding of the Grenada population. So yes, definitely keep taking your vitamins, keep taking your ginger, keep taking your turmeric, because it will help, but it will not prevent. The only thing that will prevent is vaccination.
It takes you thus far, but not far enough. I think that's
exactly.
Yeah,
exactly.
And I think for the rest of life, it's all about not just getting to first base, but getting to home base. And certainly, it is good to get to first base and second base, but believe me, we want to get to home base so that we can score. Ladies, we all the time, but I'm sure I will be forgiven from the powers that be internally. My final question: What are the takeaways from all of this? We've been through the first wave. We have to find a way to adapt to the new normals. The conversation about protocols and this and that. But ladies, what is the takeaway from the first wave as we prepare ourselves, as the health officials keep saying, for the inevitability of not if, but when the second wave comes, and God forbid it actually would come. But
so I'll start. I would say my takeaway is that we don't have enough people vaccinated, and our numbers are just appalling, just around 36, 37%. So we really need to get that up. But in this holiday season, with all the festivities going on, I want everybody to take the responsibility to keep your masks on and encourage everyone else around you. I know there have been so many parties where you feel like you're the only one wearing the mask, And I think it's so important to be vocal about your own safety and also the safety of your friends and family. So if each of us who's listening right now could wear the mask, wash their hands, and be safe and protect everyone else around them, I think that would make a huge difference.
Dr. Noel?
Yeah, I think my view is going forwards. We're going to go through the holiday season, and then we're going to come out of the holiday season, and then the children are going to go back to school. And one of my biggest concerns is that we definitely have a very, very low uptake of children being vaccinated 12 and over. And they are a vulnerable population. And what we are seeing now with the new variants are that the young people are the ones who are being affected most. Originally, it was the elderly, the comorbidities. The deaths that we're seeing now in Europe is in children and young people, which is really scary. And we've had deaths of children in Trinidad, which is just our neighbor. And the way to protect is to vaccinate. And as I said, we have a robust childhood vaccination program, and this is just adding an extra layer to it. If I had young children, my children are all older now, they're all vaccinated. If I had young children, I would not be hesitating to vaccinate them because I would want to protect my children. So that would be my takeaway.
For me, it will be that slide where we have the COVID-19 related deaths in the Caribbean, and we are ranked 4th. It's very high. So we're in that position because we're vulnerable due to that successful lockdown period, no community spread, and low vaccination rates, which was 17.7 at that point in time. 95% of the individuals that would have passed away were not vaccinated.
Vanessa?
If I may, I'd just like to add that it's so important to go out and get tested. There is no shame in going out to getting tested and knowing your status, because I think what a lot of people fail to realize is not just for protection of self, it's protection of everyone that you interact with. So get out, get tested. If you're symptomatic, isolate, stay at home. We have protocols in place to aid in that quarantine and isolation process. So get tested, know where you stand, and get vaccinated.
Vanessa, we did the reverse order now. You're last. We saved the best for last, maybe?
Save the best for last. So I want to wish everyone out there a happy holidays. And remember to get tested if you have any symptoms, quarantine, and follow the COVID-19 protocols that is mandated by the government of Grenada. And keep safe and keep our children safe.
Thank you, ladies. My guests this morning, Tanya Khan, Dr. Jane Noel, Nikita Kudrow, Vanessa Matthew Belmer, and Nandi Noel. A special edition of To The Point for today, the 9th day of December. The takeaway from it, we all have a collective responsibility at the end of the day. Vaccinated or unvaccinated, we have a collective responsibility. Go out, choose, listen, learn, trust the science, trust your sources as well. The same way you would trust what you see on social media before you literally you swallow it. Maybe you can listen, but before you swallow, maybe call the expert, call Dr. Jane Noel. Call Tanya, call Nikita, call Vanessa, call Nandi, and say, ladies, I'm in a bit of a bubble. What shall I do? Ladies, we really appreciate this. I appreciate it's a collaboration between the Grenada Broadcasting Network and the St. George's University School of Medicine. The Windrift team, continue to do what you do. Keep us informed and keep us on top of that new Omicron variant. I'm not much of a Transformers fan. Leave it there. and then again, ladies, all the best early enough to you, and happy holidays to you in advance.
Thank you, and happy holidays to you.
Thank you. All the best to you. Team, this is where we leave it now for all our viewers, wherever you are, those on social media and across the different platforms. We say thanks for being part of this special this edition of To The Point. Until then, so long. JC loves you. I'm out of here.